Hi friends, do you want to gain more than 8 centimeter of height by surgeries, or are you planning to gain 4 inches, 5 inches, and how it is possible? So when you talk about limb lengthening, we already know that there are three methods of limb lengthening. One is pure Elizaro method, another is lengthening over nail method, and third is internal nail method. In India, we usually use lengthening over nail method because it is most affordable method. Want to go for limb lengthening in one segment, usually we can achieve 20% of pre-existing limb length. As far as TBI is concerned, we usually go for 5 to 6 centimeter or up to 7 centimeter without any complication. And in femur, you can go for 7 to 8 or 9 centimeter without any complications. With complication, you can achieve whatever you want to achieve, but it is not good to gain 1 centimeter more, but with deformities. So how to gain 4 inches, 5 inches means your target is 12 centimeter, 13 centimeter. That is by two segment limb length. Today we are going to discuss about this, and today we have another patient who has target of 14 to 16 centimeter, and we will discuss about the staged limb length. Hello friends, I'm Dr. Sunil Saini, trauma and Elizaro surgeon, expert in limb lengthening, deformity correction and pain management. If you have a target of achieving height by limb lengthening method, by surgery, and where your target is more than 8 centimeter, then you have to decide that it cannot be achieved in single segment. If somebody is saying that tibia can be lengthened 9 centimeter, then there will be disproportionate, number one. And it is very well documented in all the articles and all the center all over the world which are doing the cosmetic limb lengthening, that if you want to go beyond 6 centimeter, 7 centimeter, definitely there are chances of deformity in tibia. As far as femur is concerned, we go for 7 to 8 or 9 centimeter, but beyond that there are higher chances of disproportionate of the body, and thirdly there are chances of complications in femur. So how to gain then 8 centimeter, 9 centimeter, 10 centimeter, 12 centimeter? Then best thing is you need to go for two surgeries. You need to choose the segment, that femur as well as tibia. So now there are three methods through which we can go for two segmental lengthening. One is called segmental lengthening, in which first we will go for tibia or femur or vice versa. Now here what we have done, we have gone for femur first, and then later on we will go for tibia. And the second method in which individual go for cross limb lengthening, where one side femur, one side tibia, and vice versa, later on other side femur, other side tibia. So nowadays we are not doing cross lengthening, we want to go for segment, individual segment, and later on after giving a gap of 4 weeks, another segment. And there is a third method in which we say quadrilateral limb lengthening. In only in one sitting, individual go for femur as well as tibia, but a lot of physio is required and there are higher risk of complication. Even cosmetic limb lengthening centers worldwide are not following quadrilateral limb lengthening most of the time. So usually patients also didn't prefer to go for that because a lot of things, a lot of physio and very big setups are required for that, and at single go we cannot achieve this much. So here what we prefer segmental. First we are going for one segment, femur or tibia, but I have chosen femur first because in femur we can give maximum amount of height like 7 to 8 centimeter or 9 centimeter if it is comfortable, and then we will go for tibia. So when we are going for femur, we need to give a gap of 1 month. Once the complete lengthening process is over, then we will go for tibia. This is how we are doing at Global Hospital Trauma Center Patodi in Global Healthcare India. And here is another individual who has planned for this surgery. Here we have done the surgery on 8th of November, and this is your LRS system. So there is a nail inside, and these are the two pins proximally, two pins distally, and these are the CD units. And we will start the dissection because today it is post-operative 3 only, and you can see it is on the other side also. And we have provided the maximum rail so that he can go for 8 to 9 centimeter of limb lengthening. So if you are planning for lengthening, for if you are targeting for more than 8 centimeter, even 8 centimeter, 10 centimeter, that you must decide that it has to be done in two segments. If you want to go for 10 centimeters, best you go for 5 in femur and 5 in tibia. In spite of going in one single, it is not possible. Then you can gain 4 to 5 inches. Like if we talk about 5 inches, 12.5 centimeter. So this surgery was done on 8th of November 2025, and today is post-operative 3. We'll discuss with him how is his journey for limb lengthening and when he has decided to go for limb lengthening, and the 3 days pre-operative planning, surgeries, and now 3 days has been already over in our hospital. How is feeling and how is his journey right now?
Hi guys, my name is Raj and I'm from Mumbai. Today it's my third day. If I say about the pain level, today is the first day. I'm feeling little mild pain, but it's bearable. So, I remember on the first day when we were going for the surgery, in the middle of the surgery, sir was talking to me, how are you feeling, Vikas? Are you feeling good or nervousness? So, I was very much excited for this because as in my previous video I have already told you that I always wanted to be an actor and model, and you guys know that to be a model actor you need a very good height, personality and look. So I think it's one of my dreams. So I'm here and I'm in a very safe hand. And whenever sir comes and he do physio or he talk to me how you feeling and anything, it gives me more motivation. So we have a physiotherapy ma'am as well. Even she, whenever she talk to me and whenever we do our physiotherapy and everything, it gives me more motivation. So I'm just hoping for the best and I want to go max to max. Let's see how it goes. So yeah.
So now on third day, pain is very minimal, है ना?
Very minimal, very
So
minimal.
this is exactly truth, because initially pain is, if you say it's a big surgery, we cannot say that pain is always zero, but we keep patient on epidural catheter, and we keep on managing the pain with the help of epidural catheter. Here he has been shifted from the ICU to the room, and then we removed the catheter yesterday. We have removed and we have started the Clexane. Another complication which can happen is DVT clots. For that he is already undergoing physio. Achha, other than physio, other than surgery, went very well, and
Very well.
today you're completely
From day
comfortable.
one to day three, I was very excited. Even I'm excited right now. So you know how it goes. So let's see. Yeah.
And how's the fooding at fooding and
Fooding, I have to
lodging
talk about
at
the
Global Hospital?
nutrition and everything, about the staff and everything. It's all about the mark. I would say if I want to rate, then I can give 10 on 12 or like 100 on 100 because I like the service and everything. So yeah.
So we will keep on making his videos in between also, and this is the LRS system. Till 3 days, his journey is totally perfect, and we always have a protocol, because we, whenever patient comes to us, whenever individual contact with us, we always do pre-operative counseling. So I remember 8 months back we have a online
Yeah.
discussions. We have a thorough discussions of online only, in which we have already discussed each and every point. This is most important thing. If you are planning for limb lengthening surgery, you must discuss with your surgeon each and every point pre-operatively in advance. It's not like that you're coming today and you want to go for surgery tomorrow. So it's not an emergency surgery. I always recommend that plan your surgery, planned everything. He's one wonderful person who has planned everything. He talked to me 8 months back. Then all the investigations, we have prepared his body completely, because as it is not an emergency surgery, we can, many times there's vitamin D deficiency, there's iron deficiency. We have given supplementation, already is on medication and supplementation, so that your body is completely ready for surgeries. So it's a cosmetic or stretch or limb lengthening surgery, life changing surgery. You have to keep yourself also motivated, and our team is always here to motivate him, to motivate the whole individuals who are coming for limb lengthening. Global Healthcare India at Global Hospital Trauma Center Patodi, we are providing the most affordable limb lengthening in India, with maintaining at most every care. It's not about that if we are most affordable, then we are not taking care of each and everything, or our quality is poor. No, it's not like that. We have removed the middleman so that the direct benefit will go to the patient, and that's why we are here to provide the most affordable limb lengthening, maintaining every quality. So the OT is best, the fooding and lodging best, the physio is totally going on, and it's most comprehensive package. So still, if you're looking for limb lengthening, you can contact on the below number, Global Healthcare India, and you can achieve your heights and gain confidence in your life. Thank you so much.